We go.
Great. Thank you very much, Sheldon, who is my very dear friend. Sheldon and I actually met for the very first time at the Summer Institute on Inclusion in Toronto, Canada. I don't know if you remember, Sheldon, it was the year we were in some high-rise hotel.
Yep.
And
Primrose, we called it. It was the Primrose Hotel.
and the elevator got stuck with a bunch of people in it. And I was one of those people. And so for the rest of the week, I just took the stairs. I was like on the 20th floor, some ridiculous thing, but I was not getting back in that elevator. So, and we had a wonderful time in Toronto learning about better ways that we could help people live good lives in the world. So anyway, so that's where Sheldon and I first came together. I'm going to start by showing you a short video. In Michigan, our Center on Excellence with Intellectual and Developmental Disabilities, the university-based center, which is called My DDI in Michigan, put together this series of videos that highlights different folks and maybe the success or the way they're able to live their lives because of self-directed services. And so I want to start by showing you a quick video. This is Alex that I'm going to show you. I hope that this works. I'm always scared about video because, so if you can't hear it, somebody give me a thumbs down or something, but hopefully you'll be able to hear this. So here we go.
Kimmel, the self-determinator.
I don't think we were ever really looking for a cure, because Alex is Alex, but there certainly were some aspects of his life that sure seemed like if we could figure out how to make this thing easier, life would be easier.
He's someone who helps educate, inspire about the possibilities that people can have if given some opportunity to make some of those decisions. When we're going to work, we go stop at the gas station. He usually has a water with some chips. From there
Jan,
on,
I'm not quite sure we're seeing your full screen.
I'm sorry, what?
I'm not sure that we're seeing your full screen. The video kind of stopped just after Beth was talking.
Okay, let me stop share and try to reshare it.
Make sure your sound, well, the sound is coming through fine, but make sure your sound button is clicked at the bottom.
It is. So let's see
Yep.
here. All right, let's try it again. We're going to try one more time, and if it doesn't work, we're going to call it good. We're going to exit full screen. We're going to try it this way. Okay.
that I like to spend with Alex just to catch up. How was your previous day? What activities were you up and about? How'd everything go?
He arrives in the morning and he knows the tasks that he
No,
has to
it's not coming
accomplish.
through.
He is
It's not working.
No.
You're not seeing it. All right. Well, then we're
Do you
not
wanna
doing
do you want to send me the link?
sure. It's just a mystery to me, but yeah, I will send you the link.
We're gonna have a conversation about embedding videos in your presentations when next time.
Well, no, it's actually embedded in one of my presentations, but it never works either. So I don't
Okay.
know what I'm doing
Alright.
wrong. Anyway, so I'm going to copy this and I'm going to send it to Sheldon. Hang on, people. Okay, I just sent it to you in the company of others.
Email. All right, we'll get it.
Okay, hang on.
We'll
It's
say it
going.
again.
Okay. All right. And maybe we can see that at the end because we don't have much time. We only have an hour and I want to, talk to you about other things. So we're going to let Sheldon see if he can make that work. And I'm going to share my actual
literally this morning, I closed $200,000 on the spot. I'm not making this up. I cannot make.
Sorry. There you go.
What's happening? Who was that? What was that?
That was me trying to open your YouTube. So you're good. I'm going to mute myself here.
Okay. Okay. Thank you. Like what? Okay, here we go. All right, folks. So can you see if somebody could open your screen or turn on your screen and tell me that you can see my presentation
It
here?
looks good. We can see your presentation.
Perfect.
Yeah, we can see it, Chad. Thanks.
Okay, thank you. So I'm going to talk to you today about self-determination in Michigan, and particularly focused on a kind of a partnership collaboration that's called Partners Advancing Self-Determination, which is we're sort of the leading group of families, advocates, people within the system who are trying to drive self-determination in Michigan. I'm going to start by telling you a little bit about myself. This is me with with my second to youngest son, my daughter-in-law, some friends. But I've been an advocate for 38 years. I'm Tim and now Dion. I now have another child, Dion, Tim and Dion's mom. I'm Mary's sister. Mary and Tim and Dion all receive services through the behavioral health system. I'm a lifelong ARC member. I've been an employee of the ARC. I've been involved in self-determination in Michigan myself from the very beginning when it first started becoming a concept in Michigan, and also person-centered planning and facilitation in Michigan from the very beginning when it first became a concept. And my when I first was learning about person-centered planning and facilitation, it was more focused on what I was doing for a job. But of course, very quickly I realized, oh wait, this is for my sister Mary. And then of course, as I had children that would require supports from our systems, I realized that all of these things were not just important to the people I serve, but also to my own family personally. So what I want to start by sharing with you is this notion, I'm going to talk a little bit about some history because I like history and it helps us understand where we are, right? So when we were first thinking about self-determination in Michigan, it really came from the self-advocacy movement. It really came from self-advocates saying, we're sick and tired of other people telling us what we need and what we can have by way of services and supports. And we know what we need and we know what we want our life to look like. So, both in Michigan and in the world of self-directed services, it starts with self-advocates saying, listen, we want something different, right? And so, but really the word self-determination, that notion, the concept of being self-determined really started in this country with the American Revolution, right? That's what the American Revolution was about colonists saying that we wanted to determine our own fate over here on the other side of the ocean. In Africa, in South Africa in particular, that country, the end to apartheid was another version of the concept of self-determination, right? So when we think about self-determination and the principles, and we think about that first one being freedom, and you stop and consider kind of historically when else that notion of self-determination was a strong factor in what was going on in the world, you can think of these two very important times in our history. That it was about a shift in power, right? So like in the movement in South Africa to end apartheid, it was about shifting who had power in that country. Any civil rights movement is about shifting who has the power, right? And so when we think about self-determination in Michigan, we still really very much think about it in terms of being a civil rights issue or a civil rights movement. And so, the history of self-determination is really about people looking for more independence, more freedom, more autonomy, more ability to control aspects of their own lives, right? To control their own future. And so, we know that disability rights are civil rights, and that whenever we segregate people, we violate their civil rights. And what we also know is that systems that kind of force us to remain in poverty or allow us limited options in terms of where we can live and how we can live, that's also violating our civil rights. And so even though our traditional systems are there and meant to support and help us, in reality, they often, by accident, violate our civil rights. And so, when we think about self-determination and where it kind of comes from, it started, I think, in this country in 1964 with the Civil Rights Act, right, which outlawed discrimination and was the model for disability rights legislation, right? Which is the ADA, right? So in 1990, July 26, 1990, I was actually in Washington, D.C. during the Capitol crawl when people get out of their wheelchairs and crawled up the steps. I was there with some people who did not get out of their wheelchairs. So it was quite a important time in our history. But that really, when you think about it, the Americans with Disabilities Act being signed into law really allowed for some doors to be opened so that we could begin to think about using Medicaid dollars differently and begin to think about how we can give people more power and autonomy and control over their own lives. So I think some of these things that have happened in our history, right, help bring us to that place. The same thing with the independent living movement. You know, when Ed Roberts was at Berkeley and he was trying to figure out how he could go to college and live there and be supported, right? And so centers for independent living were created. And if you think about independent living philosophy and then also principles of self-determination, you know, they really are very similar and they are very connected and complement each other. There was the Mental Patients Liberation Front. This is a contribution from my friend Pat Carver, because I had not known about this group until she brought it up to me. But again, this was in the 1970s, a time when people who had psychiatric diagnoses were beginning to say, hey, wait a minute, we also want to not be discriminated against. We also want to have a voice in our own treatment and our own lives, right? So in the beginning in Michigan, which we began to learn about a family that was in New Hampshire, right? We began to learn about some work that was done in New Hampshire. So we heard Doreen came to Michigan and she told us the story of her and her brother Jack and how he was living in a facility that cost, I don't remember the numbers, maybe $150,000 a year or something like that. And she was at a meeting and she found out how much his services at that place cost. And she said, well, I don't think he has $150,000 life. Why don't you give me the money? I can help him have a better life. And I don't know why. And I don't think it was really this easy, although she tells the story as if it was, but somebody gave her the money, right? And said, try it. And so in the state of New Hampshire, they were, you know, sort of using this idea of providing people control and authority over their own, the money that follows them, right? The money that is used to support them, to see if they could craft a better set of services and supports that would allow them to have better lives. And they quickly showed that they could. And so because of this, because of Doreen and Jack, the Robert Woods Johnson Foundation put out an RFP for some grants, and Michigan applied and received one of 19 state grants to try to push forward self-determination. So we're just a little over 20 years in Michigan in trying to think about how we could use the principles of self-determination to change our service system in a way that it would allow for people to have more control and more freedom. Some other things that influenced us as in Michigan, as we were beginning to think about this, was a book that was written by Joseph Shapiro called No Pity. And it was really kind of a history of the disability rights movement. And one of the things that was kind of noted in the book No Pity, there are a couple things were noteworthy, but one of the things that was noteworthy was this notion that sometimes the disability rights movement was a little more siloed and fractured, right? So people with developmental disabilities were over here with an agenda that, you know, met their needs, and people who were blind were over here with an agenda that met their needs, and there wasn't necessarily always a unified front. And one of the things that self-determination was able to accomplish was to sort of create a way that anybody who might use system supports could come together with the same goals and the same purpose and the same desired outcomes, right? And so we learned a lot from just thinking about that history and how we could all come together in around that idea of freedom. Then there was a monograph that was called Affirmation of Community that talked about how we could maybe do things differently. And so this was a work by Tom Nerney, and we really we brought Tom Nerney to Michigan quite a bit, and he really helped us to, here he is, we really helped us to think about, right, how we could design a system in Michigan that would be so different from the traditional services that we had been offering to people in the past, and how we could really acknowledge people's rights and their abilities to, determine their own lives and to control some resources. And so, for Tom, it felt like a fundamental shift in power. Now, I'm not going to tell you that in Michigan, we went ta-da and shifted the power, because even 20 years later, you'll see when I talk a little bit more about what we're doing right now, we're a long way from this ideal that Tom taught us about and wrote about, but we are always working. That's sort of our North Star, right? Is the idea that we can really shift the dynamic here and create a system where people whose life it is are the drivers of the bus, if you will. So we're talking about, a power shift, right? Another really influential person for us was a woman named Ellen Cummings. And, she really talked about the idea of being able to control resources. So, at the time in the 1990s, when we were working on our Robert Woods Johnson project, we were doing a lot of work with Ellen Cummings and Tom Nerney and other people who were very, at the forefront of self-determination. We were also at the same time working with lots of people like Jack Pierpoint and Marshall Forrest and John O'Brien, who were at the forefront of this notion of person-centered planning and building your circle and creating allies, right, and community building. And I just remember some, really great conversations that we would all have together. And I just remember one time John O'Brien and Tom Nerney were somehow in the same place at the same time. And, Tom was fond of saying that person-centered planning without self-determination is a trick. It's dangerous and harmful, because if you don't have control of the dollars, then you can put all kinds of great things in a person-centered plan and it can never happen, right? And then John O'Brien kind of retorted with, well, self-determination without person-centered planning is also a trick, because if you aren't focused on, bringing together the community and building community, then you're not going to be able to really experience true self-determination. So it was really interesting to have both of those sort of forces and philosophies in our community at the same time. But definitely one of the things that we learned is that being able to control some resources really does create a different kind of freedom. So then we began to build some infrastructure around those 5 principles of self-determination, right? Freedom, authority, support, responsibility, confirmation, all of the 5 principles that I know you all probably have heard about throughout this whole conference. And so as we continued to work, we were building this system built on the principles of self-determination. And so some of the tools that we really tried to focus on in those early days was the idea of being able to create a budget and get a set of dollars that you could actually decide how to spend. And then the idea of having some infrastructure in place so that the money was separated from the system. So like the fiscal management services or the fiscal intermediaries. And so in the very beginning, we spent a lot of time developing those 2 pieces, right? Those 2 tools for self-determination. And we still obviously spend a lot of time working in refining how that works for people, both refining the role that the fiscal management service plays, but also refining what that budget authority looks like here in Michigan. So after 20 years, oops, what happened there? There we go. So after 20 years of doing this, some of the things that we've accomplished, one, we do have language about self-determination in our waiver. So if you read the Medicaid provider manual in Michigan there, and if you do like a word search at the top of the provider manual and you put self-determination or self-directed services, you will see that there are some provisions in some of our waivers for folks to be able to spend some money using self-determination, such as goods and services, which would be, purchasing something that would like replace your traditional service, right? So like, I don't know, a gym membership or buying a Roomba to like automatically vacuum your floor so you didn't need to have a staff person to do it or things like that, right? So there's actually some language in our Medicaid waiver, which is kind of cool. Self-determination is required in all of our counties. So we have a county-based community mental health system. And then they are contracted with these regional prepaid insurance health plans. And then those PIHPs or prepaid health plans then contract with the state. And in the contract that the state signs with the prepaid health plans, self-determination is required. And then in the contract that those prepaid health plans signs with the CMHs, self-determination is required. And there are a whole set of rules and guidelines around what that needs to look like. Most notably, that people can direct, right, the dollars that are in their budget, and that they can make choices to purchase things that are not part of the traditional provider networks or provider panels that a lot of the community mental healths have. And we have some really strong infrastructure around like the financial management services. We have been really trying to develop the use of support brokers, which is someone you would hire directly that could do some of the things that maybe a traditional case manager might typically do, or other things that you need help with. Like if you were looking for a job, maybe helping you, find some contacts, or helping you recruit some staff, or whatever it is you might need help with. And so those are some really good sort of tools that we have in place that we've been really trying to develop. We also have a DD Council funded group that's working to promote self-directed services, which is the PAS, which is that first slide that I showed you, the promoting and advancing self-determination. And that is a group of people that includes individuals from our DD Council, from our University Center on Excellence in IDD, from the Department of Health and Human Services, which is our Medicaid agency basically in Michigan, some local community mental health, some individuals with lived experience. And that team really does a couple of things. We do two things. We work on public policy advocacy. So we look at places where the rules don't really work well for people, and we try to come up with suggestions of how things would work better to present to the department. And then the other thing that that group really does that is probably our most impactful work is that we will work with a team in a community that consists of people with lived experience along with folks from the system, and just really work intensively with them for a period of time, like say 6 months, on coming up with new policy or new practices or new resources so that they can better implement self-direction and better promote self-direction. And so some of the things that folks have done when they've worked with our team is they have realized, we have too much paperwork that families have to fill out when they want to sign up for self-directed services. So let's see if we can cut down the amount of paperwork that they have to sign and fill out. Or we have too many random meaningless trainings that we tell direct support professionals that they have to take. Can we reduce that to just what the feds require, and then let individuals choose what other trainings they want their staff to have? So those are the kinds of improvements that the PAS teams have created in their own communities. A couple of others are things like budget reports are very hard to read. Anybody who's not an accountant probably struggles to read them. And so some of the teams have worked really hard on some plain language budget documents that are a little bit easier for folks to navigate. So those are the kinds of like really sometimes big system changes and sometimes little tiny changes that help to help people to have better access to self-direction. So some of the issues and problems that we continue to see in Michigan that are things that we're continuing to work on as a state is that implementation of self-directed services is not consistent across counties. So I'll get a call from someone in a small rural county because they would like to have independent facilitation of their person-centered planning process, which, by the way, is not necessarily just for people in self-direction, but it is something that everybody in Michigan can have. That's also in the contract, right? Well, so I'll say, sure, I'll do that. And then we'll, lo and behold, find out that the county, CMH, has no idea how to make that happen because they've never had somebody ask for that service before, even though it's been here for more than 20 years. So then, we'll get through that hurdle. And then as we're engaging in the planning process, we'll realize that the person would really like to maybe hire some community living support workers directly rather than try to find some through an agency, because maybe there just aren't a lot of agencies in the area, or they just don't want to use an agency, or whatever the reason, right? And I've actually had counties say, well, we don't do that here. Well, obviously they're supposed to do that there because it's in their contract, but they don't promote it, and people don't know that they can choose it. And so people don't choose it. And so then it doesn't happen. And that is something that happens in a number of counties in Michigan. So we know that there's not consistent implementation or consistent promotion, right? Another struggle that we have in Michigan is that the contract language with regard to enforcement, right, isn't super strong. So when you have a county like that, it's not like the state sweeps in and says, hey, you got to fix this right now, or, or something, right? That's not what happens. And so sometimes the correction of those inconsistent implementation issues is slower than it could be, just because there isn't like a strong connection between the contract and then what happens if you don't do that particular thing in the contract, right? And then and kind of related is the fact that in rural areas, very few people have the opportunity to engage in self-directed services, because honestly, with the shortages we have of social workers and psychiatrists and direct support professionals in Michigan, which I know is similar in other states across the country, often in rural areas, there's nothing to self-direct because there aren't any people you can hire to be a direct support worker. They don't have enough, there's hardly enough case managers that work for CMH, let alone social workers outside of CMH, or people who might be interested in being a case manager or support coordinator, outside of CMH. And so the resource there, the lack of those non-monetary kinds of resources sometimes has gotten in the way, especially in our rural areas, which then is, I kind of say it twice here, because again, that lack of direct support professionals has really sort of hamstrung supports for folks. I would say that most of the people with lived experience on our PAS training team have great, robust budgets. They work with CMHs that are doing an amazing job helping them and supporting them as they self-direct, but they don't have enough. They have like money sitting in their budget that they can't use because they can't find the service or support or item they are trying to purchase, right? And so that's been kind of a struggle here in Michigan. And the last thing, and this is one that we're all, the state, the counties, the people with lived experience, we're all kind of working together on this, is because people really do want more authority over their budget, right? They want to be able to move money from one service area to a different service area if something in their life changes, without having to jump through a whole bunch of hoops. Like an example is, maybe somebody works 40 hours and they have supported employment, but then they end up, their hours get cut. And so they want to switch some of that supported employment to some community living supports so that they can get help or support to go take an art class instead, right? Well, that's you can't just change the numbers in Michigan. You can't just move the money from one service code to the next service code in Michigan. And so then what happens is that people have to go back to the drawing board. They have to amend their person-centered plan, submit new authorizations for approval, and it can take a really long time. And so now the art class you wanted to take is already over. And so that budget authority piece is a frustration, I think, for everyone, both in the system and out of the system. And so we're really trying to figure that out in a way that makes everybody feel comfortable that we're also following rules related to billing codes and how that has to happen and how you get things authorized, right? Because there are some times reasons for the wacky things that we do with budgets and that kind of thing. So we're really working really hard on that right now. So oops, hang on here. There we go. And so, we just really, in Michigan, oops, I see some things in the chat. I'm so sorry.
We'll get to them at the end, Jen. You're
Okay.
fine.
All right. I'm sorry, I usually like to answer questions as they come, but it might be people are having side conversations. So anyway, so in Michigan, we're really continuing to try to do two things. One, make sure that everybody knows that that's an option for them. Even 20 years in, you can talk to somebody who's been receiving some kind of support for a very long time, and they really still don't know what self-directed services or self-determination is, right? So we're still doing lots and lots of that outreach in Michigan. And we also know that our system is clunky, and so we're still also doing some of that, public policy advocacy and public policy change work so that we can make it more accessible for anybody who wants to engage in self-directed services. So that's kind of where we are in Michigan right now. This is another homage to my friend Pat Carver. There's a saying that says people that don't know their history are doomed to repeat it. And there's also a thought that the greater offense is to know the history and to not live in its truth and to not act on its core values and its beliefs, right? And so, one of the things that we really, really try hard to do with the PAS group in particular that I'm a part of is to kind of look really hard at some of the things we've tried before that haven't really worked, right? And that didn't turn out to support people in the way that we would hope that it would, and try to continuously move away from things that take us away from our values and move toward things that take us more toward our values, right? And so, I think that we see that like there's a way that you can organize your support that's called it used to be agency with choice, and then it became choice supported agency. They've worded it a bunch of different ways, but essentially it would be a way that you could do that I could contract with an agency instead of that agency contracted with CMH to purchase some services that agency provides. And so, in Michigan, we've gone back and forth with what that agency supported choice looks like. In the beginning, we really wanted agencies to be employers of record only, right? So you're kind of the employer in name only, but if it's my staff, I'm going to be the one that's giving them their job description and supervising their work and directing their schedule and all of the things. And so in the beginning, like 20 years ago, there were some provider agencies that were like, oh, okay, sure, we can do that. Well, then that's all well and good. But then when there's a workers' comp claim, or when there is a person feels that they've been wrongfully terminated and they file some kind of complaint, it's the agency that is on the hook for that, right? And they've maybe had zero interaction with that employee in terms of dealing with whatever it was that they may have been fired for, or training them around whatever issue it was that caused them to be injured. And so that was one of the things in Michigan that we started out with the idea that people could just get an employer of record, but the employer really wouldn't get to have very much to do with the day-to-day with the staff. And then employers started realizing that, wait, no, that's not really a good for us in terms of the liability. And so we had to rethink what that looked like if we were going to get any providers to be willing to partner with families, right? And so now the way that it looks is it's more of a shared responsibility for the various functions that an employer might engage in, right? So I'm still going to get to pick who comes to my house, and I'm still going to get to say, the things that I want to make sure that they get taught and trained on. But the employer of record also gets to have a say in what they get taught and trained. And the employer of record also gets to have a say in, things like, what does their background check look like when that goes through, or, what does their employment history look like? And so it's more of a shared responsibility than a fully on the person. So that was a big change that we did. And so there were some folks that were doing in the beginning that agency with choice, and then they didn't like it as things evolved and the agencies began to have more of a say over things. And so then, we saw a bit of reduction in the number of people who even wanted to try that choice or that option, and more of the direct hire kind of model, when people were engaging in their, purchasing that community living support. Some other things that I'm seeing in Michigan, that are increasing, is that people are realizing that they can actually use that budget to do more than just hire staff to do staff tasks, right? And so we're seeing more things where people are using their dollars to, do equine therapy or horseback riding, therapeutic riding, or having gym memberships. I'm trying to think of some other things, a museum membership, or taking classes, or things like that. We used to be able to use our goods and services billing code to do all of those things that I just named. And then there was a change in our Medicaid waiver language, and it kind of made the change in the language created a situation where nobody could use goods and services because there really wasn't anything you could buy based on how the language was worded. It essentially said that goods and services had to be a substitute for human assistance. And it was interpreted to mean human assistance of any kind. So if you stop and think about that, you wouldn't be able to buy horseback riding lessons anymore using goods and services, because that's human assistance, because there's a human teaching you to ride the horse. And so like a lot of people had things like they were buying with goods and services that they couldn't use goods and services to purchase anymore. And so they had to think about other ways they could use their system budgets to do that. And so that was like another one of those changes that had to be made because of some structure of the system, but people figured it out. And they also learned that you can, if you wanted to, you can do self-direction for outpatient therapy, or self-direction for engaging a psychiatrist that isn't part of the CMH provider network. And so I'm seeing more of those kinds of things in Michigan too, where people are buying like clinical services off the open market, if you will, as opposed to necessarily using the what we'll call in-network providers that are offered through our CMH system. So a lot of those kind of changes that we've seen over time, right, with how we do it. If you want to learn more about the history of any of this history, but the history that kind of brings us to the notion of self-determination or self-directed services, the book No Pity is wonderful by Joseph Shapiro. Lives Worth Living, which is the documentary about the civil rights movement, Crip Camp. When you think about the story of those young people who came out of that camp, they were the forefathers, honestly, of self-determination and self-direction. So that's kind of my presentation. And I know that we've got a lot of time left because I talk so darn fast. And so I guess I would open it up for some questions or just discussion if folks wanted to do that. Oh, so somebody
There
says
are- Yeah, there are a couple of things in the chat if you want to do those first.
yeah, so it looks like, how can we get a copy of that budget? Oh, I can send Sheldon, I'll send you a copy of a couple different budget worksheets we have that we're working with, if that works.
Sure, we'll get
Because-
them to Amy and they can post them along with the video.
Because this person, I don't know who it is, Buzz somebody at Comcast. What's your name, person? Whose email is Buzz? Maybe they don't want to share it.
He's welcome to unmute if he wants.
Mm-hmm. Yeah, I miss Tom too, Marion. Oh, Denise, sorry. Okay. Yeah, so we can get that. And then it says here that, okay, now this is really a question probably for Sheldon, you and Marion. It says that we are no longer being given budget reports in New Jersey and don't understand how that's allowable. I'm curious about that too, because I thought it was in the Code of Federal Regulation that recipients need to get like a report of whether they're in self-direction or not, that they have to get a report of the kind of an explanation of benefits that shows what they've spent.
Well, I wouldn't be someone to speak into that because I'm new to New Jersey and I'm still learning all the ins and outs of that.
So
So
Marion, what say you about that? I'm curious.
Hi, well, good question. I would suggest that you talk to your support coordinator, because that is definitely something that the support coordinator, if it's not happening for you, they can get in touch with, you know, the DDD quality monitor, and certainly relay that information, because yeah, I would agree, you know, anybody who wants access and wants information should absolutely have access to that information. And it should be, I love how you were talking about budgets in plain language, Jan. I think that's absolutely critical. The same way we treat any other document, you know, it needs to be accessible to all readers. But yeah, so that's what I would suggest. We have been asking, DDD is not making them available. Okay, well, Denise, we are certainly taking feedback from these sessions and sharing them with DDD. So rest assured that will happen. And hopefully you will be contacted about that. We will definitely let them be aware of this concern. Thanks for bringing it to our attention.
So DDD, is that like your DD agency that handles?
Yes, yeah, sorry, the Division of Developmental Disabilities that you know, works under the Department of Human Services in New Jersey.
So in Michigan, when people have an individual budget and they're doing self-direction, they would get that monthly budget report from the financial management agency or service that is supporting them. So like we have I'll just say my one of my family members uses a company that's called Stuart Wilson Incorporated. And so every month that family member gets, she and I both actually get a report of what her budget original, you know, the starting amount, how much she spent this month and year to date, and how much she has left. And so that comes every month from that financial management service. So I'm curious to know, Denise, if you are working with like an organization like that is helping you kind of manage the budget, and if they wouldn't be the place where you need to go to get your budget report. I don't know if that's how you're doing it in New Jersey or not.
That's a good point too, Jan. Absolutely. And that's why I was saying it might be easier too for Denise and other people to have their support coordinator be that liaison. Oh, and Denise is saying Easter seals and they claim they don't have to. Okay. Yeah, Kathy, it would be wonderful. We will definitely take this information back. That should definitely be happening for people.
Yeah, I thought it was in the federal regs, but I mean,
well, it should be too. I mean, because essentially, even though there's limited budget authority in New Jersey, there's still, I mean, it's a fiscal intermediary. So
right.
The person is the employer of record, or they're the co-employer. So they absolutely should have that information. So thanks for raising this, Denise. We will definitely take that back.
Jan, if you want, we can also play that video that you
yes,
had.
I would love for you to play the video. Okay, I'm going to stop sharing so you can do the video. Thank you.
No, it's not that one. Hang on. I gotta give me a second to get there now.
Okay.
Want to make sure I have the right one up. Yeah. Okay. Share screen, share sound.
Okay.
I don't think we were ever really looking for a cure, you know, because Alex is Alex. But there certainly were some aspects of his life that sure seemed like if we could figure out how to make this thing easier, life would be easier.
He's someone who helps educate, inspire about the possibilities that people can have if given some opportunity to make some of those decisions.
When we're going to work, we go stop at the gas station. He usually has a water and some chips. From there on, it's about a 20-minute drive. That's usually the time that I like to spend with Alex just to catch up. How was your previous day? What activities were you up and about? How did everything go?
He arrives in the morning and he knows the tasks that he has to accomplish here. He is self-motivated and self-driven. He takes those tasks all on his own, which primarily include running a powered sweeper through the warehouse to clean up dust and spills. He manages our damaged bags by scanning the UPC codes on those damages, and then we run them through our computer system to relieve inventory. It's a wonderful relationship.
People want to feel safe and they want to feel valued. Everything else kind of comes second.
And what he's hoping becomes his full-time gig is he owns a business called the Self-Determinator. And as the Self-Determinator, he gets hired by universities or different entities within community mental health to do presentations.
My career is dedicated to helping others know of the power of self-determination.
I could be spending the better part of a day training, and Alex will walk in and spend 20 minutes doing his presentation, and the impact is more significant because of, just who Alex is and what he's presenting and the message he's sharing.
Alex takes his person-centered planning quite seriously, and he put some very specific goals in his person-centered plan. But Alex said, hey, I want to be physically fit. So boom, there comes at this point it's Anytime Fitness and softball and bocce ball, walking buddy twice a day. Another goal in his person-centered plan was, I want to have friends. I want to be interacting with people. So I guess the drive is from him. It's what he put into his person-centered plan, and then that gives us our marching orders of, okay, this is what we need to be working on.
Well, Alex came into the choir this year, and he really has a very nice voice, and he contributes quite a bit to the men's section in the choir. He works hard at rehearsals. In fact, you can see it on his face. And when there's a good part that he really likes, well, he really likes it.
He's also in the Clarkston Community Band. He plays clarinet, and we've been doing that on and off since 2011, I think.
He's busy, he's doing so much. And I think what drives him is based on his desire to help get this message out.
I remember him telling me that he believes that he is blessed to be called a person with autism because he thought that there were those in the autism community who needed to hear what he had to say.
My purpose is to build safe, loving relationships where all feel valued.
He's got it. He understands what it is that we all need, and he's trying to help others understand it.
It's just life. And I think one of the gifts of Alex has been our whole life slowed down, and I think it's benefited the entire family. We slow down and we celebrate things.
We joke around sometimes saying the slower you go, the quicker you get there. And that's what Alex is referring to. If you slow down, the quicker you'll be able to understand where it is that I'm coming from, and therefore you'll be able to support me. Don't put limits on your dreams or the dreams of others. Don't put limits on your potential or the potential of others. I think that's what we can learn from Alex.
I'm very glad we got to share that. Thank you. So Alex, he's called the Self-Determinator. That's what he likes. That's the name of his business, and that's how he refers to himself. And Alex is someone who needs to have somebody with him most of the time. So he's all those things he does, he's always got support. They're lurking in the shadows sometimes, but he's always got support. And he and his family guide and manage that support. I saw a note in the chat, I think from Kathy. Yeah, Kathy, about your sister. And, there's another video. That video series is from Wayne State University, the Developmental Disabilities Institute, and it's called the Possibilities series. And there's a bunch of videos that people did. And there is actually a story. There's a couple different stories of people who have very significant, thank you for putting that in the chat. There are some people who have some pretty significant multiple disabilities, right? So there's maybe a barrier to speech, and there's maybe some physical barriers, and also the intellectual disability, who have really full, busy, great lives that are really out of the, because in Michigan, we also closed our day programs and a lot of our sheltered workshops. And so people had to think about, okay, where else am I going to go where I can belong, where I can be doing something that's meaningful to me, right? And so check out those possibilities videos. It might give you some ideas for your sister. Was there, oh, there's the video of Alex. Was there any, I don't know, any other thoughts people have or questions or comments or things you would like to share?
Just so people know, I put both the link to the possibility series and the link to the video for Alex. So hopefully those will end up in the chat and we can share them when we share this presentation online as well.
Right. So if you look at, gosh, almost all of them. Liz is the one I was specifically thinking out that maybe Kathy you would be able to relate to with your sister maybe, or Abby. So if you go to the series, you'll see different people you know, focused on, or different people featured that really have wonderful lives regardless of what their history was or what, you know, what their labels might be.
Really lovely comment. Thank you, Mary Ann. It says, thank you, Jan. We hope to stay connected with you in Community Drive. The great work continues in Michigan. Thanks for setting such a helpful example.
Well, thank you. Thank you all. Thanks for coming on the call. I'm always happy to talk with people. I usually like to have screens on, but I understand for presentations and conferences and stuff, you don't always have screens on. So I'm good with that.
And I think with that, we'll probably sign off. Thank you all for joining us. And I'm going to stop the recording.